What if I told you a single stroke can erase your voice? But the silence after the stroke is often far more dangerous than the stroke itself. Because in those first hours, days, and weeks, your brain is desperately trying to rebuild itself. You wake up one morning, you try to speak, but instead of words, nothing comes out. Or perhaps you try to say water, but your mouth says table. You know exactly what you want to say. The words are screaming inside your mind, clear as a bell, but the bridge between your brain and your mouth has collapsed. This is not a nightmare. This is the terrifying reality for 1 in 3 stroke survivors. But here is the secret that most people do not realize in those early, dark days. The brain is not a static machine that breaks forever. It is a living, changing landscape, and with the right map, we can rebuild the bridge. Today, we are not just talking about medical definitions. We are going to walk through the journey of a patient we will call Martha. Martha is 65 years old, a retired school teacher who spent her life communicating, only to have a stroke silence her voice in an instant. To understand how we help Martha, we first have to understand what the stroke actually stole from her. When a stroke occurs, it cuts off the blood supply to specific parts of the brain. If that blockage hits the left hemisphere, which is the dominant side for language in most people, it causes a condition we call aphasia. But aphasia is not just one thing. If the stroke hits the frontal part of the brain, in a region called Broca's area, the patient struggles to get words out. This is what happened to Martha initially. She understood everything we said to her. If I asked her to squeeze my hand, she did it immediately. But when she tried to speak, her sentences were short, broken, and required immense effort. It is like having a fully functioning computer, but the printer is jammed. However, if the stroke hits further back, in Wernicke's area, the result is different. These patients speak fluently, often in long, flowing sentences, but the words are jumbled and nonsensical. They might not realize they aren't making sense. It is like the printer is working perfectly, but the document coming out is in a language that does not exist. But here is the burning question that Martha's family asked me on day 1, and it is the question that drives this entire video. Once those brain cells die, how can speech ever return? The answer lies in the most magical capability of the human body. Martha's struggle was not unique. In fact, every stroke survivor with a language deficit falls into one of several silent patterns, each one revealing a different kind of damage inside the brain. Some survivors speak in short, broken fragments, pushing out words as if each one weighs 100 pounds. This is Broca's aphasia. The mind is clear, but the mouth is locked behind a jammed motor plan. Others speak smoothly, endlessly, effortlessly, but the words make no sense. That is Wernicke's aphasia. The orchestra is playing, but every instrument is out of tune. Some can understand perfectly and speak fluently, but cannot repeat even a simple phrase like, "It is raining." This is conduction aphasia, a sign that the internal wiring between understanding and expression has been severed. And then there are the most heartbreaking cases. Global aphasia, where nearly every pathway is damaged, leaving only fragments of sound, gestures, or a single repeated syllable. Some survivors speak well, but constantly dance around the word. It's the thing, the furry thing, that is anomic aphasia, a word-finding paralysis that turns every conversation into a maze. Knowing which pattern Martha fell into was the key that unlocked her path forward. Because speech recovery is never guesswork. It is architecture, and every architecture needs a blueprint. It is neuroplasticity. Most people think the brain is like concrete. Once it cracks, the fracture is permanent. But the truth is the opposite. The brain is alive, It listens, it adapts, and above all, it rewires itself according to one ancient biological rule. Cells that fire together, wire together. Every time Martha tried to say a word, even when she failed, the neurons responsible for that word sparked like tiny stars trying to reconnect across the darkness. With repetition, their light grew stronger. Connections thickened. Circuits awakened. This is Hebbian learning, the foundation of neuroplasticity. It is the reason a stroke can take your speech, but practice can bring it back. But there is a cruel twist. The brain also obeys the opposite rule. Cells that do not fire together unwire. Every gesture used instead of speaking, every moment of silence, every frustrated pause, these tell the brain, this pathway is no longer needed. And the brain quietly lets those circuits fade. This is why giving up is so dangerous, and why the earliest days matter so much. Not because recovery stops, but because the brain listens intensely during this period, deciding what to strengthen and what to abandon. For a long time, medicine believed that once the brain was fully developed, it was fixed. If you broke a piece, it was gone forever. We now know that is completely false. The brain is plastic. It is moldable. If the usual highway for speech is blocked by stroke damage, the brain can, with intense effort, pave a new road through the surrounding healthy tissue. In some incredible cases, we even see the right hemisphere of the brain, which usually handles music and emotion, step in to take over language functions from the damaged left side. But this rewiring does not happen by magic, and it does not happen by passively waiting. It happens through specific, targeted, and sometimes exhausting stimulation. So, how do we trigger this rewiring? What exactly happens inside the therapy room that turns silence back into sound? Before we walk into the therapy session with Martha to see these techniques in action, I have a small request. If you are watching this because you or a loved one is fighting this battle, you are already demonstrating incredible resilience. Please take a second to like this video and subscribe. It helps us get this vital medical information to the families who are feeling lost right now. And if you know someone struggling with post-stroke recovery, share this guide with them. You might be giving them the roadmap they have been praying for. Now, let us look at the specific therapies we used for Martha. Recovering speech is not just about practicing talking. It requires deconstructing language into its building blocks. First, we had to address apraxia of speech. Often the issue is not just finding the word, but remembering how to coordinate the lips, tongue, and jaw to produce the sound. It is a motor planning problem. To treat this, we use tactile cues. The therapist might physically touch Martha's face or use a mirror to help her retrain the muscle memory of making an O shape or a P sound. We are literally retelling the muscles how to move. Then we move to something that seems counterintuitive. We stopped Martha from speaking and asked her to sing. This is known as melodic intonation therapy. Remember how I mentioned the right side of the brain handles music? We use melody and rhythm to trick the brain. Martha could not say the sentence, "I want water." It was stuck. But when we tapped her hand to a rhythm and asked her to sing, "I want water," on a simple two-note melody, the words flowed out. We use the musical pathway as a back door to language. Over time, we gradually strip away the melody, leaving only the spoken speech behind. But here is the part that still amazes families when they see it for the first time. These therapies are not tricks. They are rewiring strategies. Melodic intonation therapy works because music lives in the right hemisphere, the side of the brain that often survives the stroke untouched. When Martha sings a sentence instead of saying it, she is literally pulling language across the bridge into a different hemisphere. And when rhythm is added, tapping her left hand in a steady beat, the right motor cortex lights up, helping stabilize the new pathway. We are not just teaching Martha to sing, we are building an alternate road around the wreckage. But equally powerful is the opposite method. If melodic intonation therapy is a gentle invitation, then constraint-induced aphasia therapy, or CIAT, is the boot camp of speech recovery. No gestures, no pointing, no writing, no easy way out. Why? Because forcing the brain to rely on its damaged language circuits tells it, this pathway is essential, repair it. And the brain listens, because the brain always listens. These two methods, one musical, one militant, are the twin engines that drove Martha's recovery forward. We also utilized semantic feature analysis. When Martha could not find the word for dog, we did not just tell her the word. We asked her to describe it. What does it do? It barks. What does it look like? It has fur. Where do you find it? In a house. By activating all these related concepts, we stimulate the neural network surrounding the missing word, eventually nudging the brain to retrieve the word dog. But there is a harsh reality we must discuss. What happens when months go by and progress seems to stop? This is the moment where most people give up, and it is exactly where they need to push harder. You will often hear the term plateau used in stroke recovery. It suggests that after 6 months or a year, improvement stops. As a specialist, I want to tell you that the concept of a hard plateau is largely a myth. While the most rapid recovery happens in the first few months, neuroplasticity does not have an expiration date. The problem is usually not that the brain has stopped learning, but that the intensity of therapy has dropped off. We are also seeing the dawn of a new era with non-invasive brain stimulation. Treatments like repetitive transcranial magnetic stimulation use magnetic fields to excite the neurons in the brain areas surrounding the stroke lesion, essentially warming up the engine so that speech therapy becomes more effective. So what happened to Martha? Recovery was not a straight line. There were weeks where she cried in frustration because she could not say her own daughter's name. There were days she wanted to quit, but she kept showing up. She kept doing her mouth exercises. She kept singing her sentences. 2 years after her stroke, Martha walked into a coffee shop. She did not use a text-to-speech app. She did not write her order down. She looked the barista in the eye, took a breath, and said, "I would like a medium coffee with milk, please." It was imperfect. The rhythm was a little slow, but it was her voice. And to Martha, that cup of coffee tasted like freedom. If you are listening to this and you are the patient or the caregiver, I want you to know that speech recovery is a marathon, not a sprint. It requires patience, repetition, and an unshakable belief in the brain's ability to heal. Do not let anyone tell you that you are past the window of recovery. The brain is waiting for you to challenge it. If you noticed signs of speech difficulty in a loved one, do not wait. Professional assessment by a speech-language pathologist is the first step to building that roadmap. Thank you for watching this deep dive. If you found value in this story, please subscribe to the channel so we can continue to explore the wonders of the human body together. And in the comments below, I want to hear from you. Share your recovery stories, your small wins, and your struggles. Let's build a community of hope right here. Until next time, keep talking and keep fighting.